Welcome to All Things Cardio-Oncology. My name is Steve Giselle. I'm the Executive Director of ICOS. And in this podcast, you'll hear from a diverse representation from our community. We want you to be both informed and inspired by their stories and experiences, and we're so glad that you've joined us today. This is Steve Giselle at the 2022 GCOS meeting, and I'm here with a couple of really important presenters at the meeting. I'm going to ask you all to introduce yourselves.
I'm Kerry Skurka.
Trent Williams from Australia.
And you all were involved in the nursing portion of the meeting, the pre-conference.
Yes.
So, Kerry, tell us, what were the highlights for you?
The highlight for me was that it was the very first inaugural conference for cardio-oncology for nurses, because it's been a dream since I've been doing this. And to have so many nurses interested and that we were able to have such a great program was excellent.
That's great. Trent, you were a presenter.
I think it was a really wonderful, well put together course, and I think just to echo Kerry's sentiments, it was nice to see everyone in person rather than on a Zoom screen.
Yeah.
But also seeing people who were so interested in improving patient care. I thought that was the standout for me.
Yeah. Great. And what's your hope for next year's meeting?
Next year, I hope that we can bring it together and do it in Madrid is what I'm hoping. That's my goal.
Absolutely. And Trent, I think you get the award for coming the furthest, perhaps. So
I've got a 19-hour flight to beat, so I think Madrid's a little bit further than that. So okay. I think we can go for 24 hours pretty comfortably.
That's great. Well, thank you both for
Thank you so much to
ICOS
for such a wonderful program.
It is. ICOS, I just love seeing how ICOS has embraced every single discipline and surrounded its arms around this topic of cardio-oncology because it's so important. And if you haven't joined, you should join.
Thank you. Totally agree. Thank you both. I'm here with one of the hosts of this amazing event. Can you please introduce yourself?
Thank you, Steve. I'm Christine Brezden-Masley. I'm a medical oncologist, co-chair of this year's GCOS 2022, held in beautiful Toronto at the Fairmont Hotel. I treat breast and GI malignancies, and I'm the medical director of the cancer program at Mount Sinai Hospital here in Toronto. And I'm co-chairing this with Dinesh Devandanathan, who is an amazing cardiologist and a true cardio-oncologist. This has been a 2-day extravaganza in cardio-oncology with amazing presenters, amazing discussions, and really some great highlights. We had the Young Investigator Award. We had over 14 submissions for that, over 75 abstracts submitted. So really a testament to the explosion of cardio-oncology and the importance of truly assessing the heart function, ensuring that we do not cause more severe cardiotoxicity, specifically in our survivors. And we just ended a fantastic survivorship session today that had big discussions in terms of improving the heart health, both in the pediatric long-term cancer survivors and adult cancer survivors, because really this is exploding, that we'll have over 20 million cancer survivors just in the next couple of years in the U.S., and that's just an expansion in terms of globally the amount of survivors. So really, as I said, it's been 2 days of fantastic networking and really discussing the importance of cardio-oncology and to continue to build this amazing program.
Thanks, Christine. We really appreciate all the work you've done to organize this. Thanks. Fantastic job. Congratulations.
Thank you, Steve.
I'm Dr. Stefanie Mundnich from Chile. It's been so nice to reunite after 2 years of only online meetings. And in this year, I think the most important is the survivorship that they have spoken
really
about.
This morning.
It was so great. They talked about how important exercise is. There are several exercise programs throughout the world, for example, at Australia and also here at Canada. And I think that's something that is going to important to speak, that it's going to be important to learn about how exercise is important for our cancer patients.
Yeah, that was a great session, really helpful.
Yes, very great session.
Yeah. Well, thanks for making the effort to be here. We appreciate the work you do as well.
Thank you very much. It was so nice to see you again.
Yeah. I'm here with another friend. Tell me your name.
I'm Anna Barac.
Hello, Anna Barac. Welcome. How has the meeting been for you this week?
The meeting has been spectacular. It is absolutely thrilling to see all the science and new ideas that have emerged through the Zoom. And
Through the Zoom generation. And I think we are better set up than ever to answer long-standing questions. Terrific. And any presentations that stand out in your mind from the meeting so far, other than your own?
I really think that it's across the board. I thought yesterday was a spectacular day. I think we are successful in bringing and learning from other fields. So bringing the presentation on clonal hematopoiesis was fascinating. It opened so many opportunities for application of new knowledge in cardio-oncology.
Great.
The topic of multiple myeloma, we've had it over and over again, but over the last 3 years, a lot of new things are happening in multiple myeloma. So that was a wonderful example of how we knew of cardiovascular diseases, but now we have much improved survival in multiple myeloma population. So are these the drugs to think of?
Right.
So that was fabulous yesterday. I thought that the day could not be topped, but it was. Today, this morning, the presentations on survivors of pediatric and AYA cancers was just mind-blowing. That's a huge area of need, and we have moved the needle.
Yeah.
And I think that the most recent presentation on how do we use imaging, cardiac MRI and echocardiography, we have the thought leaders in the room, and I think we just are ready and poised to keep moving.
Great.
Thank you.
Thank you so much. So I'm here with some other international friends. I wonder if you could each just introduce yourself.
I'm Dan Gilon. I'm from Hadassah in Jerusalem, participating in the ICOS chapter in Israel as vice president, and have a high and long-term interest and activity in cardio-oncology.
Right.
And with my friend Zaza, who will introduce himself, we're making an ongoing effort to advance this cardio-oncology issue in Israel for the last decade, more than a decade.
Yeah, great. Zaza?
Thank you. Zaza Iakobishvili. I am from Clalit Health Services in Tel Aviv, and I'm leading Israeli chapter of ICOS together with Dan Gilon, and we're going ongoing efforts to spread the word about the cardio-oncology and include modern people to be interested in.
Great. And what was your you presented today, right? What was your presentation about?
My presentation was about one of the uncovered things of cancer survivorship. Actually, we need to establish the framework of cancer survivorship for all cancer survivors, and it's a wonderful opportunity to define risk factors and prevent and begin preventive work in these patients, because as we know, that most of these patients are getting cardiovascular disease like a complication of their cancer treatment, and cardiovascular disease is the most important part of mortality in these patients. So in cardiovascular survivorship program, if we include our well-known preventive efforts like statins, aspirin, blood pressure, and regulation and normal healthy lifestyle, it will be very, very supportive for this patient. It probably will improve their overall prognosis.
Yeah, great. A number of people commented how much they appreciated that session, so it was really good.
And I need to state that the meeting is a very important meeting. In principle, we are with the leaders in this cardio-oncology world. It's very important. We have time to learn more, to understand more in depth the issues involved, and we have time and opportunity to discuss issues which are a lot of questions and mainly the gaps that need to be bridged by the understanding, by learning, clinical work, and a lot of research work.
Yeah, great. And what do you all think is the future of GCOS? Where might it be in the future?
It should go through countries that can host it.
Yeah.
And I think we clearly will try to host it in the coming years, hopefully 2024, and we'll do the efforts and join work with the ICOS.
Yeah.
Yes, it's a lot of work to do, but we're optimistic that we'll get support in our country and from ICOS too, to make this happen in Israel.
That would be great. We would love it. So thank you both for being here and making the effort to come all that way.
Thanks very
Great
much.
to see you.
Worthwhile.
Thanks so much.
That sounds perfect. So I'm here with some other friends. Can you each introduce yourself?
I'm Edith Pituskin from University of Alberta and the Edmonton Cardio-Oncology Research Group.
And we're here in Canada. You're home.
Yeah,
so
yeah.
This is great.
I'm pretty much home turf. And really exciting to see the number of countries, the number of disciplines, and the number of individuals who are really very passionate about this emerging field that, you know, we never dreamt about when I started in oncology 30-some years ago. We won't quite say exactly how many. But yeah, this is a whole new opportunity for us to be supporting our patients.
Yeah, and Edith chaired a fantastic survivorship presentation, and a number of people have commented to me already on the exercise portion of that and how meaningful that was. So great job. And you are?
My name is Anecita Fadol. I'm a nurse practitioner and an associate professor in the Department of Nursing and Cardiology at the University of Texas MD Anderson Cancer Center.
And Anecita is the chair of our nurses working group. And tell us what happened on Wednesday.
Oh, it was an exciting event. It was our inaugural GCOS 2022 nursing conference. It was only half a day, but it extended up to about 5:30 because people are excited, and those members that attended it are so excited, and they said probably we should lengthen it to a whole day the next time.
Okay. What was the highlight for you in the nursing event, would you say?
Oh, it is so exciting to see nurses in person, as well as those global cardio-oncology members in person, which, for the last 2 years we have been working with them, but it was virtually. Yeah. So now we see each other in person, and this is the first time I also saw Edith. I know Edith by name, but then I haven't seen her in person either, so it's exciting. That's, to me, is
and that was such a great event, and you did a wonderful job organizing and managing that.
Thank you. We appreciate that. We appreciate that.
I'm here with another friend. Can you please introduce yourself?
Sure. My name is Giselle Melendez, and I come from Wake Forest University. And so I'm thrilled to be here. This is the most exciting meeting. This is the highlight of my year, actually.
It's the highlight of all of our years.
All of our
especially
years.
When it's in person.
That's absolutely right. And then it's just a delight to see everyone in person and catch up with our colleagues. And it's a great setting to be able to strengthen our collaborations. And especially now that we're seeing more research coming down our pipelines, it's fantastic to be able to be here in person and bridge those gaps that we have currently in cardio-oncology. So it's been a real pleasure to be here.
Did any of the sessions in particular stand out in your mind just quickly as
Absolutely. I think the highlight for me was the exercise session. Perhaps it was one of the most interesting sessions for me. There's a lot of work to be done in that area. And as you know, we're exploring the role of cardiac MRI also as a tool to predict future cardiotoxicity, and I think the role of CPET is going to be major in the near future. So that was a super exciting session for me. Absolutely.
Great. Well, thank you so much for being here, making the effort, and it's great to see you in person.
Thank you, Steve. It's good to see you.
Well, I'm here with some of our other international friends. I want each of you to just introduce yourself first.
Juliana Salas, I am from Costa Rica.
Welcome, thank you. And
Alexander Lyon from London, UK.
Great. And maybe each of you could just tell me what do you think have been the highlights of the meeting for you so far?
For me,
other than your own presentations.
No, it's very important to know where is other countries working and that we can work together in the future. I think that is very important thing in this Congress, and I invite everybody to link to this summit for the next time, because it's very important to work together. Really.
Great. Super inspiring to hear you talk about the work in Costa Rica today. Really
Thank
great.
you.
Alex?
Yeah, that was inspiring. And it's just great to be back together. This is the world's leading cardio-oncology meeting, 2 days of dedicated science, and we always learn new information to take back to our clinics and hospitals on how to improve the practice of cardio-oncology for our patients. And of course, meeting together in person, we get that collaborations and building new friendships and new scientific collaborations that were so hard to do in the remote working of the COVID pandemic. So it's really great to be back in person.
Yeah, absolutely. And of course, we couldn't let you go without a comment on the guidelines, and maybe a comment about how this meeting can feed into the implementation of those guidelines.
Absolutely. Well, ICOS was a partner with the ESC in the production of the guidelines, and now they are published. The next challenge is how we disseminate them into oncology, hematology and cardiology clinics, not just the big academic centres, but out in the community where so many of the patients are. So that's been one of the messages that I've heard from several speakers, is now's the time to implement them, and using the Pocket Guideline app is one easy way of colleagues upload the app from the ESC. You can upload it from the App Store. You don't need to pay for it. It's free to use. And then, of course, having meetings maybe in your clinics or hospitals to discuss the guideline and the relevance to your particular patient groups.
Excellent. Thank you so much. Thank you both. So I have a new friend here that I want to introduce. I have him introduce himself. Tell me your name.
So my name is Karlis Trusinskis, and I'm from Rica, Latvia. I am interventional cardiologist, but also very interested into general cardiology and also teaching in university, assistant professor.
That's fantastic. How did you find the GCOS meeting from Latvia?
So that was easy, actually. Just use the mother Google and enter their cardio-oncology meetings, and then that's what pops out.
That's fantastic.
This search, and I was really interested. I am interested into cardio-oncology because, as we discussed already here, so cardio-oncology in Latvia is actually not stated as a field or as a clinic or as even as a profession in medicine, but we are a small country, less than 2 million people, so basically all cardiologists know all oncologists and vice versa.
So you do it naturally.
Yeah, so we have all the mobile phones of each other. So first of all, that works in small countries. That's where that works perfectly. But of course, we are interested into developing this field. By part because also oncology now receives more money for chemotherapy, and also we expect more problems with cardiac toxicity and so on. And in order to actually gain more knowledge, gain more experience, and improve collaboration, maybe make it go from random mobile phone calling to something which is more structured and organized.
Well, that's fantastic. And highlights from the meeting? Anything stick out? It's been super.
Yeah, I can. Always you have some expectations, and then you can compare whether it was worse or better. It's better than expected.
Oh, good.
Definitely better. Very interesting topics. I have jet lag, but I think I never slept.
Good.
That's for me very good sign.
That is a very good sign.
My sleepiness never lies. So if it's interesting, I didn't sleep. I'm not sleeping.
Yeah,
so,
that's fantastic.
That's the thing.
Well, we're so glad you found the meeting. Welcome.
Sure, thanks.
So I'm here with another friend. I want you to introduce yourself. Tell us where you're from.
I'm Trishun Singh from Durban, South Africa.
Well,
and I am president of COSOSA, which is the Cardio-Oncology Society of Southern Africa affiliated to ICOS.
And those who are familiar with our podcast will remember the stunning episode that we recorded in Umzulu. Yes. Well, so what do you think about the meeting this year? How's it going?
Steve, it's fantastic. These meetings are getting better and better because we're attracting more people. We have now better data on guidelines. We have better data on surveillance, and we expect these meetings to get better because we certainly have more information to work with.
Yeah, that's great. Any one presentation that really stands out other than your own?
Other than my own, I can't think of any. Sorry, no, I'm joking. But listening to Alex, Lyon, and Teresa is always a great pleasure.
On the guidelines.
Yeah. I thought that was stunning,
amazing.
which I expect that to be.
Yeah, good.
And I've got to think of others, but all of them are just so good.
Yeah. And when is the next meeting in South Africa that everybody needs to know about?
It will be held next year in May. I think it's the 26th and 27th of May. It's a Friday and Saturday, and it will be in Cape Town at the Lord Charles Hotel in Somerset West, which is in the Stellenbosch area, which I must say, and people will remember this, that it's in the middle of the wine district of South Africa.
Oh, that
exciting
sounds
venue.
Yes, very good. Well, thank you for being here and making the effort, and we always appreciate talking to you.
Thank you, Steve.
Okay, well, I'm here again with some of our key leaders for this meeting. I'm going to have each of them introduce themselves.
Hi, I'm Dr. Susan Dent, and I'm currently the president of the International Cardio-Oncology Society.
Great. Welcome, Susan. Thank you. And
I'm Teresa Lopez from Madrid. I'm the vice president of the International Cardio-Oncology Society.
So, president and vice president. This is wonderful. So, Susan, what would you say has been one or two highlights from the meeting this year so far?
I think the highlights of this meeting, GCOS 2022, being held in Toronto, Canada, is just being able to meet our colleagues again.
Yeah.
We last met in Sao Paulo, Brazil in October of 2019, and who would ever imagine that we would go for such a long time without seeing our colleagues? And while, we've been meeting over those few years by Zoom calls and WhatsApp and so on, it does not replace the personal interaction with our colleagues. This has been so fantastic to see everyone come to this meeting. There's so much excitement again about coming here and not only learning from each other, but thinking about how can we move this field forward? What are some research ideas? How is clinical care going to be changed based on how our world has changed? So it's been absolutely fantastic. And I was even surprised coming to this meeting because I had two of my former fellows show up that I didn't know about. So it was so fantastic to see that enthusiasm. I've seen so much enthusiasm at this meeting.
Yeah, it's been so great to be back in person. And Teresa, we can't have you comment without saying something about the guidelines and, what do you think we can do from this meeting in terms of implementation?
Yeah, thank you, Steve. I think that it was really important to present at this meeting the ESC and ICOS guidelines.
Thank you.
Not just a European guidelines, it's a global guideline on cardio-oncology. And we have really interesting discussion on how to implement the different monitoring and preventing protocol, which is the most important, because to have just a book of what to do, it makes no sense for daily practice. So we need to try to promote and to educate people on which is the best way to work all together to improve the cardiovascular health of our patients. And that's why we need to push from ICOS to involve oncologists and hematologists in all these cardio-oncology clinics to really create multidisciplinary local teams.
Yeah, great. And what do you both think about the meeting next year? What's in store?
Well, this is maybe a better topic than guidelines, because you are going to have the opportunity to meet us in Madrid, Spain. So I'm honored to be the local host of the next GCOS meeting. And we already booked the venue, and we asked you to secure the dates, October 5, 6.
Already have the dates?
Next year. So we hope that you can, all of you, join us and continue to learn and to share experience.
That's great.
I just want to sort of share another opinion about this meeting as we got together again. I was just so thrilled to see the young people that we're now seeing interested in this field. So we had 3 young investigators present their research, fantastic research that we're seeing, and the enthusiasm there. And also the poster session. We had many posters, people presenting what they're doing around the world. It's truly a global meeting, and it's so great to see that. And also, we had a number of our chapters present their updates on what they're doing here. So great enthusiasm. I'm looking so much forward to Madrid, Spain next year. I can't wait.
We all are.
And we're looking forward to seeing all of our colleagues there next year in Madrid.
Yeah, well, great. Thank you both so much for all the work you're doing just for this meeting, but also obviously for ICOS. So thank you.
Thanks.
Thank you.
For more information about ICOS, you can go to ic-os.org, where you'll find more information about all of our programs, including our weekly webinars, our board certification exam, and other resources that we know you'll find helpful. Thanks for joining us today, and we hope to hear from you soon.